Hi everyone, thanks for joining us for our webinar focusing on mental health roles in MSF projects. I would like, and we would like as MSF Australia, to acknowledge the Gadigal of the Eora Nation, the traditional custodians of this land, and pay my respects to the elders both past and present. This land always was and always will be Aboriginal land. In recognition that we are a binational association, I also take this opportunity to say kia ora to our colleagues joining from Aotearoa, New Zealand. My name is Jackie Clark and I'm part of the field recruitment team with MSF Australia. Tonight's webinar aims to provide information about mental health specialists working overseas with MSF. This evening we are joined by Scarlet Wong, a psychologist who worked in the Palestinian territory in 2021 and in Uganda earlier this year. Scarlet combines working with MSF with private practice and her PhD. Thanks for joining us, Scarlet.
Thanks for having me.
I spoke with Scarlet recently and we'll watch the pre-recorded interview in a moment. I will then briefly talk about recruitment processes, followed by the opportunity to ask questions of either Scarlet or myself. If you could start sending through any general questions via the MSF website, YouTube or Facebook page, that would be great. And please note, we can't answer any questions about your individual suitability tonight. If we run out of time to answer all of your questions during the webinar, we will do so afterwards. So let's move now to watch the video of my recent conversation with Scarlet. Welcome, Scarlet. Thanks for your time. A good place to start might be to tell everyone a bit about yourself, your current role, and how you came to work with MSF.
Thank you. So yes, I'm Scarlet. I'm a psychologist working in Sydney at the moment. I've been a clinical psychologist for 12 years now. I work in private practice, but I've also worked in community health and in hospitals. And I'm also doing my PhD in refugee mental health.
So you're keeping busy.
Yeah, a little bit, yes. I also have 3 kids, so that keeps me pretty busy as well. And how did I get into MSF? How did I start working for MSF? My PhD being on refugee mental health, I was doing a lot of Zoom-related work with field workers, and I started feeling quite disconnected and couldn't really relate to some of the issues they were coming with. So I thought it would be good to get some experience in the field. So I looked into working for MSF and that's how I got in.
Fantastic. And could you tell us about one of your assignments? For instance, how was it working in the Palestinian territory?
Yeah, so I was in Palestine last year from about March until November. So it was a 9-month mission. And I was really nervous, as you can expect. It was the middle of COVID. And I'd come from Australia, which was sort of lockdown, 0 cases allowed, to a place where it was a much looser environment. But I was really pleasantly surprised because I wasn't sure what the mental health I guess the level of training and experience would be like in Palestine. I didn't even know much about it. But when I got there, I discovered it was an 18-year-long project. We had clinicians who'd been there for 7 years. They had a lot of experience, a lot of training, really supportive and welcoming of me joining. And I think I actually learnt more from working with them than perhaps they learnt from me.
I think you could say that for most of us going into the field, yeah.
Yes, yeah, totally. So yeah, I really loved it. It was a really challenging mission. We had or assignment. We had an escalation, and there was a bit of conflict. But I really felt quite surprisingly safe and informed during my whole mission.
Oh, that's so good.
Mm.
And so during that time, you also started an internship program that you particularly developed. That sounds super interesting.
Yeah, so one of the things that I've discovered working in Palestine was that Australia and other Western contexts have a lot of structure around the title of psychologist and how you can become qualified. Whereas in Palestine, for example, there's only 0.7 of a psychologist for every 100,000 people.
Right.
Whereas in Australia, the statistic is 95 for every 100,000. And one of the issues was there's not enough supervisors or internship placements for psychologists to get practical experience. So we worked with the Ministry of Health and the Psychology Association in Palestine to develop an internship program for graduates to come and work at the MSF clinic in Nablus, in the West Bank.
Yeah, it sounded like such a fantastic project where you could really feel like you could get stuck into something and you would sort of know that what you'd been teaching or what you'd been sharing was really going to last much longer than just your time there.
Yeah, absolutely. I'm still talking to some of the clinicians that are in the clinic now, and they're telling me about how they've got the interns coming through. And yeah, it's really nice to know that we've been able to help develop the training and learning capacity there.
Yeah, great. And we'll talk about training a bit more later, but maybe we could move to Uganda for a minute. And if you could tell me what a typical day might look like, even just starting right from the beginning, you know, what's the morning ritual?
The morning rituals, of course, you make coffee. You wake up and you make coffee. Everybody has a different way that they have coffee, so that was very interesting. I make it out of a AeroPress, but my colleagues would have instant coffee or whatever. But it was very funny just to learn different people's coffee breakfast rituals. But then from there, it's pretty much I don't think I had more than 2 or 3 days that were the same. There were some days that were like a regular day here in Sydney where I would see, clients and do paperwork and have meetings and so on. But usually, I guess maybe it's a bit about my role. So my role as a psychologist in Uganda was actually to assess and implement a mental health program. So the first few weeks of my assignment was about talking to people from the Ministry of Health, talking to people in the MSF clinic, and understanding the community level of understanding of mental health. Once I sort of gathered all that information, then I moved on to implementation and discussing with the team how to implement. So obviously every day was different, but I think one of the most memorable days that was very different from all the other days was when I was walking to the clinic, which I thought was just a normal day. My boss showed up in the MSF truck, wound down her window, and she said, "Scarlet, do you want to come to Bawera?" And Bawera is a town sort of in the mountains near the border of Congo, about 2 hours away. The reason why she wanted me to go there was because we'd had an influx of displaced Congolese people due to some conflict. And so we were going to go there and just see what the needs were and do an assessment. So we ended up driving over to Bawera, and I didn't have anything on me except for my backpack and my laptop. Got briefed in the van on the way there, and then we hiked over to where people were coming in for about an hour and a half, and I was completely unprepared for that. But it was a very memorable experience, and we were able to provide some what we call psychological first aid and support some of the people coming in and help give advocacy and recommendations on what we could do to support people coming in.
Well, it definitely doesn't sound like your everyday day in the clinic or the office here in Australia, does it?
No, definitely not.
You've talked about training a little bit already. Could you tell us a bit more about capacity building of locally hired mental health workers and what that training might look like?
Yeah, so in both contexts, there was quite a large element of training involved. So in Palestine, there was a lot of training for me to support my colleagues in terms of, there's a lot of families that we were seeing. There's a lot of intergenerational trauma in Palestine, but they hadn't had a lot of opportunity to access family therapy or systemic therapies.
Right.
So I was able to support them to build on that learning and advocate for some training for them. But also we as MSF, as a team, we would do a lot of training for the Ministry of Health as well, because in the region, there's just not a lot of expertise in case management or diagnosis and that sort of thing. And there's not a lot of psychiatrists. There's even less psychiatrists than there are psychologists. So being able to support that gap with therapy was really important. And that was through a lot of training by MSF. In Uganda, we did a lot of training of basic counselling skills for counsellors in the area. There were actually no mental health services where I was based. So being able to recruit and then train counsellors in evidence-based approaches for humanitarian settings was really rewarding. We did an 80-hour training program of a program called Problem Management Plus.
So with that training, sorry to interrupt, Scarlett, was that something that MSF already had developed or something that you built?
MSF has a lot of PM plus materials. The World Health Organization has a training program already. And then I just tailored it to suit the context because there were just certain terminologies and things that didn't quite fit. And then I held it, like a couple of hours a week over my
Yeah, that's great to know that, that I think for people who are listening to this, that you're not on your own, you're not having to do things, you're in that context where it sounds like you're starting from scratch. There are still a lot of resources and support that you can draw upon.
Absolutely. I never have felt completely left alone. There's lots of support and experience in MSF in total. So online, and I was directed to different places where I could get materials and talk to other people who had implemented them. So yeah, I never felt like I was a fish out of water.
Yeah, that's good. And you mentioned before we started something about in Palestine, the term or the title of psychologist is not protected under law. Could you tell us a little bit more about that?
Yeah, so in Australia, when you talk to another psychologist, you know what qualifications they have. There are very strict rules and regulations around who can use the title psychologist, clinical psychologist, social worker. But in Palestine, anyone can use the title psychologist. I think through some advocacy, we've worked with them to change that, but it meant that anybody could use that title. So it could be quite harmful because you could have someone who's not trained or qualified to use that title. So yeah.
Yeah, that capacity building at the local level just sounds so critical given that kind of context.
Yes, absolutely.
Yeah, fantastic. Okay, now I wanted you to talk again a little bit more about the locally hired staff and why they're so critical.
Yeah, the local colleagues, my local colleagues are so critical to the work. They're the ones who give you, they kind of orient you to the context. They talk to you about what's harmful or safe to be done in context. And also in terms of sustainability, they're the ones who continue the work long after you leave. But also they are the reason why it's so enjoyable and rewarding to work there. I developed really close connections with my team in Palestine and my team in Uganda. And just learning about both cultures was, one of the funnest parts of working in both contexts.
Fantastic. Do you mind sharing with us a little bit about your 40th birthday in Uganda?
Yeah, we had a meeting and they surprised me with a beautiful 40th birthday cake. And they sang. They have really beautiful singing voices. They do a lot of singing in that area of Uganda that we were in. And yeah, they sang this beautiful harmonized happy birthday. And yeah, so it was really a huge surprise, and it was lots of fun.
Oh, that sounds a bit special. I'm sure your kids were happy to see that your team were looking after you.
Yes, absolutely.
Now, look, just coming back to more work-based topics, could you talk a little bit to the kind of clinical scenarios an MSF psychologist or mental health specialist might be likely to face? And one of the things that we always say is that it's especially valuable to have experience in PTSD and trauma-based programs, as well as, of course, clinical experience providing support for people with severe mental illness. Could you talk us through that a little bit?
Yeah, in both contexts, trauma was definitely a predominant presentation that we saw in both clinics. And it's also an area that there's not a lot of experience and expertise. So having being able to come in and support and provide some supervision or group supervision to clinicians around that was um, really helpful. I guess one thing to note though is different cultures will have a different way of looking at trauma. So being able to have good formulation skills is especially important. So for example, can I give you a case example that might help you?
Yeah, sure.
So I had a young girl that was referred to me by one of the doctors in our clinic in Uganda, and they'd been scratching their heads over what was going on. They couldn't quite work it out, and the family had been sending her to church for what they do a lot is it's very religious area. So they were sending her to church for prayers, and also to the witch doctor for uh, alternative solutions, but to no avail. And the reason why they were worried about her was because she kept saying that she was seeing the devil and seeing darkness, and she was freezing. And so she wasn't going to school anymore, and it was having a lot of sequelae of effects. So when I assessed her, and it took me a really long time, I realized what was happening was she had a very traumatic history, and there were certain triggers in her environment that would cause her to have a panic attack. And what was happening was the panic attacks were causing her to have hyperventilation, and then from the lack of oxygen, she would black out. And so they were thinking it was witchcraft because she was seeing the devil and blackness. But from a Western viewpoint, it was actually a panic attack. So once we had that formulation, I could support the clinicians on a culturally adapted way to help her and then return her to school eventually.
Yeah, just listening and learning about the context and things just must be such an important part of a mental health specialist approach.
Yeah, absolutely. Being able to listen and collaborate rather than just being very didactic and telling people what they should do is
Yeah,
really
of
important.
course. So, Scarlett, you've been to the field twice in the last 18 months. How do you manage? How do you juggle between your time in the field with MSF, your work and life in Australia? I imagine there are both challenges and positives.
Yeah, it's took me a while to find the right balance. I think I'm still finding that balance, but mainly is having, great family support, great friendship support, and both with my PhD and with my private practice, we're really good at communicating and collaborating on finding a way that works for both sides. So a lot of it's about, for example, with my private practice, I only take on clients that are not very severe or very long term, and I communicate that with the GPs that work in the practice as well, so they know. And then with my long-standing clients, they have the option to be referred to another practitioner or they can choose to stay knowing that I work for MSF as well.
Field workers often say that what they love about working with MSF is that you never know what the day will bring. And you've already given us an example of that when you had that sort of complete change going off with your boss to do that assessment. But it's known to have a certain adrenaline rush, and it takes a lot of energy and resilience, as we've talked about. What is it that particularly keeps you going back to doing this kind of work, Scarlet?
It's such a good question. It really makes me think every time, why do this, or why go back? And for me, it's definitely that sense of meaning and fulfillment that I get from working with passionate, like-minded people, but also giving as much as you receive. Normally in my work in Sydney, I feel like I do give a lot, but I'm not necessarily being challenged, or I'm not learning other things or experiencing other cultures. It's just a job, in Sydney, whereas in MSF, it's way more than a job. It's a whole experience, and the cultures, the new people, the new places. It's a dream job in my mind, and I wish I could, do it more frequently, except for the other commitments.
One or two things you have going on. Actually, could you just tell me, you've talked about training your colleagues in the field. What about training opportunities? I believe that you're going to go off and do some training soon with MSF.
Yeah. So I'm going to Brussels on Thursday. I'm very lucky to do a management training, mental health managers training, to learn more about how to, lead and structure a mental health program. And that's for 2 weeks in Brussels. It's really exciting, and I feel very lucky to be able to go and do that.
Yeah, fantastic. And, that is something that MSF really values, is trying to look at continual training. And when you've been, you've done assignments, you've done a couple now, it's, you're able to take advantage of some of these opportunities.
Yeah.
Yeah, great. Well, look, just finishing up, there was one last thing I wanted to ask you about is, your time off. When you have a day off, are there options to relax or explore? Could you tell us a little bit about that?
Yeah, for sure. I feel really lucky that in both contexts I've been in, the project coordinators were really supportive, and the security context was really open, that we could go and actually see quite a lot. So in Palestine, we were able to explore the West Bank and do some hikes in the area. But also I was able to go and see the Dead Sea and Masaba, which is an amazing monastery, built into the cliffs.
So life, quite a different life, and lots of great experiences in the everyday that you'll always remember. Well, look, thanks for that, Scarlet, and we'll finish up here. And we'll come back to Scarlet shortly for the Q&A, but we'll just speak briefly on recruitment. Currently, MSF has significant demand for psychologists like Scarlet, but we also particularly need psychiatrists and mental health nurses. We will be sending you a follow-up email with key links to our website, but I would highlight that apart from meeting MSF's general essential criteria, we have the following profile-specific criteria. Psychologists/counsellors. You must have a clinical master's degree in either psychology or counselling, and at least 2 years clinical experience after graduation, providing individual therapy. Experience supervising and training other mental health clinicians is highly valued, and working with translators or experience in transcultural settings really helps. People with a medical background always need to display no recent gap in clinical experience greater than 2 years. And for these psychologists, counsellors, you need to be available to work for 6 months as a minimum. Moving to psychiatrists, again, compliance with the essential criteria for MSF. Usually psychiatrists will be required to provide a combination of individual patient care as well as supervision and training of inexperienced clinicians. But supervision and training is really significant in all our profiles, I would highlight. Clinicians will be expected to treat mostly adult outpatient settings, and experience in child and adolescent mental health is valued. We use WHO-validated protocols, and psychiatrists should be willing to work in a team environment in a low-resource setting. Residents in psychiatry with a minimum of 3 years' experience, with at least 2 years in adult psychiatry, are also welcome to apply. And just again, no recent gap in clinical experience greater than 2 years. With psychiatrists, we would ask for a minimum of 3 to 6 months, but I would highlight that if you're only available for 3 months, there are less places and it will take a lot longer for us to place you. Moving to the mental health nursing criteria. You would need a minimum of 5 years' experience in clinical psychiatry, preferably in outpatient settings. You may also be considered for mental health specialist roles. Your extensive experience and training in counselling is required, and case management experience, particularly for patients with severe mental disorders, is highly valued. As with the other profiles, any experience supervising, training, and managing other mental health clinicians is so useful and more than an asset, really a priority for us. I would like to just say with non-clinical caseworkers, we regularly receive applications from highly skilled non-clinical caseworkers, and in particular those with refugee casework experience. And we totally recognise the importance and value that caseworkers have to offer, but we do not currently have opportunities for non-clinical caseworkers. And I did just want to highlight that all of the Australian and New Zealand applications do go through the Sydney office. We process them here. So just moving through to the kind of professionals that we need. Adaptable, who enjoy working in a team and who are up for new challenges. And it is valuable for MSF to attract people who are interested in building a career with us. There are a lot of opportunities with MSF, including support for training and career development. For instance, Scarlet recently completed MSF's mental health and psychological support training in Belgium, and she might talk about that a little later. If you meet the criteria, you will be invited to an interview, generally within 4 weeks of applying. Following the interview, there are several other recruitment steps, including reference checks, medical and police checks, and successful completion of the MSF pre-departure course, which we call Welcome Days. Once you're officially recruited into the pool of field workers, it may take a while to be matched to a project and mobilised overseas. There are many variables given the difficult context in which MSF works. However, tonight is about maximising your opportunity to ask any questions. So let's move to the Q&A. We've got a number of questions. Thank you all. I'm just going to start with John, who put a question on the website for Scarlet. I heard psychological first aid and therapy. Scarlet, would you mind telling us the difference and who can do what and when?
Yeah, sure. So psychological first aid is something that I only really learnt about working for MSF. It's, as it sounds, it's brief interventions that anyone, any layperson or professional can do. So I gave a training for doctors and nurses to do psychological first aid for emergencies. Whereas therapy would be more like, you know, the bread and butter of mental health professionals, psychologists do. So the full CBT Act, all that kind of stuff, and done by qualified mental health professionals. So I think hopefully that answers the question.
Sure. And could you just give us an example of, say, the psychological first aid, and you train some doctors and nurses? In what cases did they use it, do you think?
So, for example, when we had in Congo doctors and nurses meeting with refugees, they can approach it in a quite medicalized way. So I was sort of teaching them basic counselling skills, basic listening skills, and just things like how to link them with the right service. So maybe it's a child who's been separated from their family, so they need to prioritize that, calming them, just those kinds of things that even, for example, a logistician, I trained in psychological first aid, because they don't automatically think of those sorts of things.
Yeah, and just to explain, logistician is a term that we use in MSF, and it could be someone who is in charge of the construction or plumbing, making sure the vehicles are all working. They do a myriad of things. So it's kind of interesting that they also would benefit from doing such training.
Yeah, definitely.
Now, we've got another question for you, Scarlet, from Yama. She asks, do you do your clinical work via interpreters?
So a lot of my role was actually doing supervision and management. And so when you're working with other practitioners, it's in English. However, I did do I did do some clinical work, and that was with an interpreter, which was a great experience as well. But for the most part, it's in English with practitioners.
Right, fantastic. So, but how does that work if your patients aren't English speakers?
Yeah, so when you have the interpreter, the interpreter is obviously interpreting between you two, and the interpreters in MSF get trained on mental health interpreting, so it's quite a unique skill, and they develop the same tone and the same mannerisms as you do when you're delivering, your response in the therapy. They do the same to the client. You build a very special bond with your interpreter.
So you worked with the same interpreter for the whole placement?
So I didn't, unluckily, I would have loved to have done a full placement as a clinician. And if I had, that's what would have happened. But in my team, there were psychologists who had interpreters, and they had, one-to-one matching, and they would work with them for their whole 9 months.
So it'd be a pretty formidable team in that case.
Yeah, it's amazing. And the interpreter picks up things that the clinician might miss sometimes, even in the therapy. So it's amazing.
Yeah, sounds really important. I have another question from Basia. She or he says, hi, I'm wondering about the extent to which a clinician's areas of expertise are taken into consideration when field placements are determined. And I can probably answer that one. Look, we really do try and match the areas of expertise to a field placement. It makes a lot of sense if that's your particular area. It just might take longer for us to find that right match. But yes, we will do our very best to make a nice match to your particular expertise. And Scarlett, if you just wouldn't mind, in answer to that same question, just talking about your Palestine placement and why you were sent there particularly.
So because on my CV, they saw that I had supervision experience for a number of years, and they were just opening up a supervisor role to provide technical supervision for the team. They placed me there to do the supervisory role. Same thing actually happened in Uganda. They were looking for someone with child and adolescent experience, and it was a child and adolescent project. So they asked me to go and implement mental health there. So yeah, they definitely, in my experience anyway, try to match expertise.
Yeah, sure. And just very quickly, I mean, I mentioned in the criteria just how important that supervision and training is, and having some management expertise before you go. Is there anything that you would add to that, Scarlett, in terms of how helpful it was?
I think you learn a lot on the job. The team is super supportive in teaching you. And I also, the training management and mental health management, but having had, the experience that I've had and the supervisory experience that I'd had definitely supported me in my roles as well.
Yeah, we can't emphasize that enough, really. I have another question on the website. What registration process is involved in working for MSF? For example, does one have to register with the medical board of the country in which you are working? And similarly, does one need medio-collegial indemnity cover? And look, you need to have a current and valid registration either in Australia or New Zealand, but you won't need a registration in the country of assignment. In fact, if someone is recruited in Australia but has a valid registration from another country, that's also valid. And regarding the insurance, MSF has worldwide insurance cover for medical malpractice. The policy provides coverage for all national and international medical staff, including psychologists and other mental health professionals, in the provision of healthcare services and health, travel, professional indemnity, medical evacuation, workers' compensation, etc. And look, we have more questions, but we're coming close to the end of our time. So we will reply to those questions to you directly on the website or on the YouTube or Facebook channels. I'd like to just say a really big thank you to Scarlett for your time, your passion, your dedication to the work you've been doing with MSF. It really comes through, and it's wonderful to hear from you about this.
Thanks so much for having me. It's been really nice.